Where is the low back? When we're referring to the low back pain, according to the WHO's definition, the low back, the part of the body in the back that below the ribs and down, all the way down to the bottom of the buttocks. What is so important about the low back pain? Well, low back is supporting the whole body's movement. And so the low back pain is the number one pain in the body across the world. Who are the most vulnerable? The woman, the elderly are most susceptible to this problem, but no particular population is able to escape it. Currently, I haven't seen any medical procedures or modality that treat the low back pain with satisfactory results. So I developed this protocols after several years of trial and error, and with some of the studies, I now realize it's probably the best protocol to treat low back pain because it's based on the science and the physiology of our body. It may sound interesting because once you understand the theory behind it, it's actually very simple and easy to follow, and with great result. Why do we have to do this? Well, the textbook acupuncture treatment currently, according to the Germany study, is about twice as good as combination of medicine and physiotherapy. But it's not any better than the random needling on the low back. So the treatment is not very satisfactory to me. The right side of the chart shows what the point selection in this so-called modern acupuncture treatment according to a textbook. I called this style American style acupuncture to differentiate from the current so-called Chinese or Korean or Japanese or even the orthopedic style of acupuncture. I can assure you my style is way more effective because it's based on the physics of the body and the structure of the body. So the whole thing is based on anatomical structure of the body. So there's a spine, or S. This is the pain stiffness along the spinal column. We use a dew and ring meridian. Next is the para spine, which means that it's along the spine but on either side of the spine. Okay. For this one, we will choose the SI3 on the same side of the pain in general. Then we also use a lot on the liver 7 and liver 8. I use the L to stand for this zone. Now, if the pain is away from the spine on the low back, then it could be either on the first or inner urinary bladder meridian or the outer UB meridian. If it's on the UB meridian, the inner one, we use Yao Tong Xie, which is a point at the hand. If it's the outer, we will choose the point called GB 42 on the foot. If the pain is on the gluteus, we use GB 34 Yangling Chen. Now there's one point that's extra to the meridian. It's called He Ding. This is used for the situation where people complain pain across the low back. However, when you start to check, it's actually over the ridge of the posterior ridge of the pelvic bone. In the rare situation, you might have to use GB 26 or 27. Now, when you treat it, in many cases, you probably have to use the combination of all these. The first step of doing the treatment is to assess the condition. To do this, you have to ask the patient to lay flat on a table. Make sure the patient is relaxed, because this is a very important step. Ask the patient to wiggle the low back from side to side. And then you ask the patient to raise the hip up and down. From these two exercises, you can identify what the problem in the low back is. And then you can palpate and to confirm the patient is telling you the truth. Then you can needle the point following the protocol. If the problem is along the spinal cord, you so-called S zone, you will use the DU20 Zen 24 for treatment. If this pain goes all the way down to the tailbone, then you can use UV 57. We know the posture is very important in supporting our body. If you look at these two pictures where people are moving along, and what can you see in common? Looks like they all raise their arms. So they raise their arms in order to try to reach a balance. How did they learn this skill from? They learn it from this baby. Just kidding. Every single baby would have to learn how to walk. And this is how they start their walking. And they practice and practice for several months, and they never forget. It might sound incredible, but if the hands of this baby probably have the same balance power as the whole arm. As you can see that based on the physics, the moment of rotational inertia is proportional to the distance of the mass from the center squared. Not only the regular adults learn it from the baby, even the professional, they learn it from how to do it from the baby as well. From the onlooker, it might look scary. But in reality, is this quite stable for these people? By now, you should understand the importance of the small intestine 3. They are, first of all, they are for stability. They work with the rest of the hand to preserve the body from falling from side to side, because the rotational moment of inertia is related to square of the distance of the mass to the center of the body. The other one is also very important. It's for the power control. The arm action for sideway, we know the hands move faster than the rest of the arm. So the hand actually have higher kinetic energy than the rest of the arm. This can easily be seen in sports. For instance, if you look at a tennis player, their backhands depends greatly on the SI3. It is very interesting when you look at this picture from top-down view. It clearly shows that just our arm, especially the hand, different part of the hand actually have different purpose. On the SI meridian, it controls the backswing, and it has to be also interact with the spine. The medial side, namely the lung and large intestine, it related to the lung, the front of the body. The center of the hand actually doesn't do either one of that. Rather, it's closely related to the up-down motion of the body. If you look at this back side of this lady's picture, it clearly shows that in order to be able to control the small intestine muscular tension, the cervical spine as well as the lumbar spine both are very, very important. So because of this, SI3 is the most important point with regard to the pain on either side of the spine. Hernia disc problem is very, very common in the doctor's office. But the acupuncture is extremely, extremely good for this, because if you use SI3, you could control and relax the muscle along the spine, immediately along the spine, and relax them, and that will reduce the tension that causes the herniation. Once the tension across the spine is reduced, it's easier for the body to recover and the disc restored. If the tensed muscle crosses over two joints, the space in between the joint will be compressed. And when this happened, the mobility of the joint will be jeopardized. As a result, the joint might be painful to move, and this happened a lot. One of the reasons is that there are abundance of pain receptors around the joint area. In such a situation, all you have to do is to relax the muscle, and the joint pain will be reduced. If the pain is on either side of the spine, then we'll look at whether it's close to the spine or it's away from the spine. If it's close to the spine, over the first or the inner line of UB meridian. Then we will use the 腰痛穴. If the pain is along the outer UB line, we'll choose the point at the foot, the GB42. On this graph, you can see that in the hand, the 腰痛穴 correspond to the inner UV line of the low back. And the foot, the GB42, will be used to treat the low back pain that shows up on the outer UB line. So if the pain is over the buttocks, most commonly found in the people that has over the hiking, too much hiking, or pregnant woman come with the back pain. For these conditions, we use the GB34. The effect is super. The question here is that suppose we have a complaint of hip pain or IT band syndrome or lateral side of the knee pain. What point should we choose? It's commonly see people use a heavy roller to roll the IT band, and to the point that it's all bruised and without much effect. If we just look at the medial side of the thigh muscle, you can see there are lots of muscle. So when these muscles are tight, it will produce all the problem we just talked about. So to treat that, the best points to use will be liver 7 and liver 8. Sometime you can add the middle point, mid-thigh point. This point is actually best to use the maxibustion. If you look at the front of the leg, the femur, you can see that at the right center is a big muscle called rectus femoris. This one goes from the anterior superior iliac spine to the patella. Just imagine when this muscle is become too tight. What's going to happen is that it is going to put a pressure on the pelvic bone and make it tilted forward. That would create a pressure for the body to try to straighten that out. In order to do that, the back muscle has to be used to move the pelvic bone backward. So that will cause the pain at the low back along the ridge of the pelvic bone. So to solve this problem, all we have to do is to needle the hurting and to relax this rectus femoris muscle, and the problem will be solved. The area we are talking about is shown on the model on the right, the white area. If the pain, however, is higher than all we just talked about, over the thoracic spine, along over the kidney area. What point should we do? The answer is kidney 3. This is very interesting because this is the only place that kidney 3 is effective, and it's quite effective. There are two pain conditions that are very difficult to treat, and it's extremely painful for the person who is suffering from it. One is so-called sciatica pain. If you look at the sciatica pain, it's related to the nerve, the sciatic nerve. Sciatic nerve is a very long nerve. There are a lot of speculation as to what causes the pain, and the truth is that it involves many, many muscles. So the best way to treat it is to follow the treatment protocol we just mentioned above, and treat any zone that is painful, including spine, low back, liver, buttock, etc. And if you can do that, the result is very, very good. It's much, much better than just treat the GB30 as is recommended by many authors. The most complicated pain to treat is called SI joint pain, because it involves many, many muscles. If you look at this diagram, you can see that how many muscles are involved. You can see that the painful area could be the hip joint and the lateral side of the body underneath the arm. Okay, and in addition to this along the spine, lumbar spine area, bottom part of the lumbar spine area. So to be able to treat it, you have to be concerned with all these areas, like treat the regular low back pain, do 20 and 24, small intestine 3, liver 7, liver 8, may also involve the 腰痛穴. Okay. Then you have also to treat the GB30 area, around the area, any 24 tender area. And after that, you also have to treat the sensitive area around the spleen 21. It's called the great embrace point. And this point will be much beneficial is treated with maxipustion. So to summarize the protocol, we will look for the spine or along the spine, the liver meridian, liver 7, liver 8 has to be the first 2 points to be considered. And then look at the pain where there's a UV line on the outer side, out UV line, or inner side, inner UV meridian. Okay, and then you can look at the gluteus. And then if there's some problem with pelvic ridge, you will choose the hurting. If you follow this protocol, you will find out that even though low back pain is sometimes people say it's very difficult to treat, you will have a lot of success of doing the treatment. Thank you.